Hello. If you're taking an antidepressant and wondering how long you should stay on it, then you're in the right place. My name is Dr. Vicky Cleak, and I'm a consultant general adult psychiatrist. And today we'll talk you through what the guidelines recommend for how long to continue with antidepressant medication following an episode of depression. Remember, this is general information. Always speak to your clinician about your own individual situation. So when someone has depression and takes an antidepressant, the aim is not only to treat the immediate symptoms, but to allow a solid recovery and to reduce the risk of them relapsing back into symptoms of the original depressive illness. There are some clear clinical guidelines as to how to prevent that happening in terms of how long you should continue with the treatment for after remission of symptoms, so that that risk of the symptoms coming back is reduced. This will depend on whether this was your first episode of depression, whether there is a family history, and how severe the episode was. It's also worth noting that antidepressants are not considered to be addictive in the same way as substances like nicotine or alcohol, but they are medicines that you should not stop suddenly without planning and thought, because stopping them too quickly can lead to a discontinuation or withdrawal symptoms, which we'll cover later in this video. So let's break it down by typical scenarios. If this is your first major depressive episode and you've taken an antidepressant and responded well to it, in other words, all of your symptoms have resolved, then guidelines recommend continuing on that antidepressant for at least 6 months from when your mood has returned to normal, and as long as there are no imminent or significant stresses on the near horizon. If you've had 2 or more episodes, or you've had a very severe depressive episode, perhaps it's psychotic, or there are ongoing symptoms, then the recommended duration rises. For instance, some guidance suggests at least 1 year from remission of all of the symptoms in higher risk cases. If you've had more than 2 episodes and you have other significant risk factors, then more time would be appropriate. So the more episodes you've had, the more severe these have been, or the more risk factors you carry, for example, other health problems or psychosocial difficulties, then the longer you may be advised to continue with your treatment. It's important to understand that these are guidelines. They're not fixed rules, and the decision is always individual. Your doctor should review your history with you, how you responded to your medication, any side effects, and your preferences, as well as the risk of relapse for you personally. So why might someone stay on an antidepressant long term? Well, there might be a few reasons. If you've had multiple previous episodes of depression, then your risk of relapse is going to be higher. If you still have residual low-level symptoms and they've not been resolved, or there are psychosocial physical health problems, then continuing the antidepressant may well make sense to prevent things getting worse for you. But so may reviewing the diagnosis and your risk factors, because there is some intervention that might be able to help with those things. There may be another diagnosis coexisting, which is stopping you from getting better and needs to be addressed. For example, alcohol dependency, ADHD, going through the perimenopause, or experiencing post-traumatic stress disorder. The decision may also involve other treatments, such as therapy, lifestyle changes, as well as how stable you feel. So when a person stops or reduces their antidepressant, 2 things can happen which may feel very similar: a relapse of depression and withdrawal or discontinuation symptoms. And it's really important to know the difference between them, because they have 2 completely different management requirements. Relapse means your original depressive episode has come back. So the mood goes low again, maybe alongside other features like a loss of interest and pleasure in things, changes to your sleep, your appetite, with fatigue, guilt, poor concentration. While a relapse can happen at any time after stopping or reducing the medication, the risk is highest in the first 6 months after stopping. The decision to stop the medication may be influenced by how many previous episodes you've had, how strong your recovery was, and whether any residual symptoms remain. So withdrawal symptoms, these are psychological or physical symptoms caused by the body adjusting to the lower dose or absence of the antidepressant if it's happened too quickly. Examples include dizziness, electric shocks that feel like they're in the brain, flu-like symptoms, insomnia, vivid dreams, nausea, agitation, and anxiety, and they can be exceedingly unpleasant. Often these appear within days of stopping or reducing the medication, particularly in medications which have a short half-life, such as venlafaxine, or if they're at a high dose. These symptoms usually last a few days to weeks, but for some people, they seem to go on for longer than that. They're not necessarily a sign of a relapse of depression, although they can be very distressing, but they can be mistaken for a relapse. Because of this, it's safer to taper the antidepressant gradually rather than stop it abruptly. So if you reduce or stop your antidepressant and you suddenly get dizziness with brain zaps, a flu-like feeling, that's more likely to be evidence of a withdrawal rather than a relapse of your medication. But if you gradually slide back into a low mood with loss of interest, that may well suggest a relapse instead. Always check with your clinician. So how should we approach stopping antidepressants safely and without side effects? Well, here are some good principles in considering stopping your antidepressants. The first thing is to discuss this with your prescriber. At review, you should talk about how long you've been on your medication and whether you're ready to consider stopping it. And your doctor should help you assess your history of depression, the response to the medication and any side effects, any ongoing risk factors, and your current well-being. It's really important to ensure you've been stable for a good period of time, and it's generally recommended that you've been in remission for a period before considering tapering it down. Plan the taper of the medication rather than stopping it suddenly by reducing the dose gradually, for example, in step-down doses or smaller increments as time goes by. Some guidelines suggest reducing the dose by a quarter or a half and then getting increasingly slower as you go on. And that can take a number of months for some patients. Watch out for withdrawal symptoms. If you get any new physical or psychological symptoms after a dose reduction, then talk to your doctor. Slower taper might be more appropriate for you. We should always monitor for a relapse of the original depressive episode. So after stopping that medication, remain in close contact or at least be reviewed by your clinician after a month of being off the medication. Therapy such as cognitive behavioural therapy, lifestyle interventions such as exercise, good sleep hygiene, and maintaining social connections all help to reduce the risk of relapse. So it's about shared decision making. The decision to stop must balance the risks and benefits of continuing, side effects of continuing, and your own preferences as well as life situation. So if this is your first episode of depression and you've got back to feeling your normal self, you should usually stay on the antidepressant for at least 6 months after remission. So that's after you've got back to your normal self before considering coming off it. If you've had 2 or more episodes or there are risk factors for relapse, you may need to stay on the medication for longer, up to 1 or 2 years or even more, and in some cases long term under supervision. And that's okay. Never stop your antidepressants suddenly. Withdrawal symptoms are very real and unpleasant for some patients, and stopping too early also risks relapsing back into the original depressive episode. Always discuss with your clinician because the decision to stop is personalised, and keep in touch with your care team to monitor your mood on an ongoing basis. The non-medication supports such as therapy and lifestyle are all key parts of a plan of staying well. So thank you for watching. I hope this gives you a clearer idea of how long antidepressant treatment is usually recommended for and how to approach stopping it safely. Remember, this is a guide, but your situation is unique. So speak to your doctor or mental health professional before making any significant change. Take care, be kind to yourself, and good luck with your recovery journey.